Report. We're here in Tijuana at the Immunity Therapy Center, and we're joined with this gentleman. I'll let him introduce himself, and he can tell you about who he is and what they do here.
Thank you, Ben. Thank you for being here at ITC Immunity Therapy Center. My name is Carlos Alvarez, and I'm a Director of Business Development here at the center.
Okay, and what is your role?
Well, I'm in charge, and I supervise different departments here, like the advocate department, customer service, patient services. So we have established certain procedures for, people that are interested in our medicine. So when they call us, we have everything in place to help them and give us all the information about our program and put everything easy for them to come to the center.
Mm-hmm. So your department helps coordinate patients who are visiting.
That is correct.
So thank you. I'm thinking about your facility here. It's called the Immunity Therapy Center. Most of the clinics that we visit are specifically cancer treatment facilities, but your facility has a broader range of diseases that you treat. Is that right?
That is correct, Ben. We specialize in cancer as well. Dr. Bautista, his main focus is cancer, but we also treat other autoimmune diseases, chronic degenerative diseases, and infectious diseases.
I see. Okay. So you mentioned Dr. Bautista. He's the director of the program?
Yeah, Dr. Bautista is our medical director. He has been practiced with alternative medicine for more than 25 years. And basically, he devoted his life to this kind of medicine because when he was finishing medical school, his father was diagnosed with lung cancer. Okay, so he saw in 6 months, of treatment, everything that his father faced back then with conventional methods. So after his father unfortunately passed away, he said, I need to find other ways to treat these kind of diseases. Mm-hmm. So he devoted his life to research and practice with less invasive, more natural ways to treat these conditions. So he started very, very young, working with other hospitals, other centers that were practicing with alternative medicine. He became the medical director in one of those centers. But later on, he decided to go solo and start his own practice. Mm-hmm. He started with a very small setup, and that was, years ago. But in 2007, he founded Immunity Therapy Center. Mm-hmm. Okay, and as I said, he started little, but because good results, he started growing very, very fast. So now in 2020, he opens his new facility. So now
in this building.
So we have now a 8-story building with state-of-the-art equipment, so we can provide the best service to people seeking with this kind of treatments.
Okay, and the name of the organization, the name of the facility is the Immunity Therapy Center. I guess I would want to make a distinction between immunity therapy from immunotherapy, which is a very particular type of oncology. Mm-hmm. Is there a relationship between immunity therapy and immunotherapy, or does it mean something different?
No, yeah, there is a relation. What I have learned in all these years working with him is that one of the pillars of his program, and he combines more than 30 different therapies into these programs.
I see.
And these are the therapies that he has found out in all these years of practice and research that are giving him the best results.
I see.
So one of the focus is to work in the patient's immune system in order to stimulate, in order to wake up that immune system, so the body of the patient, which is designed to heal, can help us in that healing process. Okay, so the immune system is a very important part of these protocols or this program, but also he has other therapies, not like the alternative therapies, as he called it, with the special equipment that he has in order to also kill cancer cells in the process. Okay, also he has other of the pillars of the programs is the IVs. So he has a series of intravenous protocols in order to help the patient. So it's not one therapy working independently. It's the combination of everything that he has in his belt that he can tailor the program according to the patient condition and then obtain the best results possible.
And are there specific protocols that are available here that might not be available in other parts of the world, like the United States?
Well, I honestly, I don't know much about other centers. What I know, and this is because the patients tell me, is that they decide to come to us because they found all the protocols that we're looking in one place. So if you tell me about other centers, what I have heard is that here he has a very, very comprehensive program. Okay, so
as you said, there were like 30 different approaches that are combined to create one holistic approach to healing.
Yes.
Interesting.
One of the things that because I mean, people ask me, what makes you different? Because we know we are
That's
not
what
the
we
only.
want to know too.
We are not the only center, So it's the experience of Dr. Bautista, definitely. Also his devotion of his career. I mean, one of the things that I have experienced is that in other centers, the medical director is not there. I mean, sometimes he becomes like a marketing figure. I mean, for him, the most important is his patients. So he's here all the time. He has every morning has a meeting with his board of medical staff to discuss each case, to see how each patient is responding to the protocols. So if he needs to tweak the program, he does it. And this is daily. Also, when the patients come, he's the one that takes again the previous medical records. When the patients walk in, we also do our own test, and he's the one that designed the program or tailored the program according to that specific situation. So that's one thing that makes I think different than the other centers, and the other is the different protocols that he has. I mean, the more than 30 protocols that he can use in order to create that personalized program for the patient.
And I think it's going to make for a very interesting conversation between Dr. Bautista and my father, Dr. Ralph Moss, when they start talking over the science and the philosophy and where some of the best practices are being taken on board and where that information is coming from, because one would assume that it's not just, Dr. Bautista's observations only that have contributed to his protocol, but things that he's learned along the way and other influences and so forth. So I'll leave that conversation to Dr. Moss and Dr. Bautista to have. In the meantime, would you be kind enough to show us around the facility and we can have a look and see what's here?
Yeah, I would love to.
Thank you for that introduction. Let's take a walk.
Okay. Well, right here in this floor is the 6th floor of the building, is where the administration are, and also we have the office for the advocates. When someone is interested in our center and would like to learn more about what we do here, we have very, very experienced advocates that have been with us for many years. And so that's the first point of contact, where we can explain exactly how the program works, the different therapies that we have, the cost, the logistics. So we try to make the trip for the patient as smooth as possible, because we know they're facing a serious condition. So for us, take care of the transportation, the hotels, we help the patient all the way so they can concentrate what is important for them, which is healing. Okay?
That's very good.
So this floor is for the advocates. We have administration, as I mentioned, and also here in one of the doors is Dr. Bautista's office. Okay? On other room here is the meeting room. Here's where Dr. Bautista has the daily meetings with his staff. Mm-hmm. Okay. In each floor we have, areas where the patient can be. In this case is where patients wait to see Dr. Bautista. Mm-hmm. He tries to see his patients face to face at least twice a week. Mm-hmm. Okay, so mm-hmm. he assigned medical doctor to each of his patients. So the doctor and the nurse is assigned to each patient so they can follow up every day with them. Mm-hmm. And they report to him in their meetings, but he sees them twice a week as well. Mm-hmm. Okay, well, here we have patient services. This is Anna, and we have the director of operations. Okay, this is the personnel that receive the patient the first day, explain. We have a welcome package that we give them to them so they know where to go and so get familiar with the building as well. Okay. Yep. Also in each room, in each floor, we have a terrace. So because it's important for us, for the patients to go outside and also for the companions,
Yeah, let's have a look for the view.
Yeah. Like raining a little bit.
Yes. Oh, this is lovely.
Yeah. So Dr. Bautista created these spaces for the companions, and also they can spend, sometimes with the family member. We always encourage the patient to come with a companion because the emotional support for us is very, very important. Mm-hmm. So we ask, if your spouse, your daughter, your son can come with you.
Every floor has an area like this?
Not every floor, but okay. Most of them.
To say that you are centrally located would be an understatement, I think. It seems like you're right in the middle of the Tijuana downtown, really, right?
Yes, well, actually, we call this the business district of the city.
Okay.
We are just 3 minutes from the border.
Yes.
So this is the newest area of Tijuana. And also because, it's very safe. This is a very well-protected area from the government, so it's important for us. And also, we are a few steps from the border.
Can I ask you a question about Dr. Bautista's results? Has he been able to publish, or has he published any of the results of his protocols in a scientific journal of any kind, or if our audience wanted to learn more about his protocols or about his philosophy, what's the best way to do that?
He has published everything in his own website.
Okay.
That's how he does it.
I see.
Yes. Quick look here.
Yeah.
Here is where we have a more private room for certain specific protocols. We have the hyperthermia here. We also offer bio-emotional therapy. Also the emotions is very important for us. So we offer that as a part of the program. Okay.
Now, hyperthermia is administered in different ways. Which method do you use? Do you have like the tent that people go in and they...
Yeah, we have the chamber, the whole body hypothermia, where you elevate the temperature of the body of a certain temperature in order to kill those cancer cells.
Right.
And also we have localized with the spatial lamps that we can concentrate where the tumors are.
And do you know, and I know this is more scientific, but the hyperthermia, is it used in conjunction with chemotherapy, or is it just pretty much a standalone procedure?
No, it's not a standalone. I know he combines it with other protocols, but not specifically which ones. But I know he combined it.
Got it.
Yes.
Thank you.
So we have also physical therapy. Sometimes, the patients have, because the nature of the condition, they have, pain. So we try to use therapy, physical therapy as well.
This is very interesting to me. Bio-emotional balance therapy. That's something I haven't heard before. Can you tell me a little about that?
Well, we have a person that has been certified, and so it's just like provide with emotional support.
I see.
Okay, if there's
so it's almost like psychotherapy.
Yes.
But it's like counseling and emotional support. Okay.
Yes.
But I like your name for it.
Yes. Sometimes we have doctors that outside doctors.
Right.
If the patient, for example, sometimes because the nature of the condition, they have a heart problem, something that is a little bit outside of the scope of the program, we can call an external specialist so they can have a consultation as well. So we're trying to offer all the services that they need. So this is the fourth floor. This is when some of the medical staff is. So they have the daily consultations with the patients.
I see.
And also we have the therapy areas right there. So we can just go and take a look if you want.
Sure.
The head of nurse also is in this floor. So we have messages all over the building, to motivate the patient, trying to be friendly environment. We work in semi-private areas for certain therapies, where the patients share the room with other patients. That's something that has worked with us very well because the patients can share their experiences and
not be lonely.
Not be lonely. Okay, so that's something that we like, and that's why we have these two semi-private rooms where many of the protocols are administered. Okay, we can just. So this is one of the setup. So same setup in the other room, and we have, as you see, a nurse station right there. So the nurses are always, there checking on the patients. Okay. We receive around 25 new patients every month. At the same time, depending on the month, we can have like a 30 to 35 patients because there are patients that they see the results and they wanted to stay longer. Okay, but that's the capacity. That's the number that Dr. Bautista likes because he don't want to have, many patients because the personal attention for him is very important. So that's something that he can handle. Everything works well. He can dedicate his time to each of them. So that's the number that we manage. We don't want to, have 50. No, we wanted to keep it this number. Okay.
Got it.
This is the hospital. One of the hospital floors. We have 17 rooms for inpatient patients. Okay. There's patients that are advanced. There are patients that need to be monitored 24/7. We encourage most of the patients to stay as an outpatient. Okay, we have inpatient and outpatient program. And the outpatient, we help them with accommodations. So we have apartments, we have hotels where they can stay and come every day to receive treatments. They stay, the outpatient patients stay like 5-6 hours every day. So it's very comprehensive. They will be busy, but also we offer them lunch and dinner or breakfast and lunch. They receive 2 meals, 2 healthy meals every day here. Okay, so either they are outpatient, they spend most of the day here. But for the inpatients, I mean, people that need more close care, we have the rooms. Okay,
I see. But the nutritional programs is designed by Dr. Bautista.
Yes,
In conjunction with his nutritionist staff, right?
exactly.
And you have on-site laboratories, or do you send things out?
We have inside laboratory and also the CT scan.
Okay.
Is in-house.
Oh, you have a CT
yeah,
scan?
we have a CT
I
scan
see.
machine
Very
in-house.
good.
Okay, so this is the other, we have several rooms for patients here, but also we have the surgery room in this floor.
Okay.
Okay.
I see that.
Yeah.
Is it something you can show us, or it's sterile?
This is sterile, so we cannot go
Okay.
in, but
Understand.
we
Can
have
we look
for
through the
certain,
window
yeah,
and-
sure. We have that for certain procedures, you know, and sometimes we need to install a catheter or things like that. This is one of the other nurse stations. So I think
I can
there's
tell you something.
I think there's a procedure going on right
I
now.
think that this is a
That's,
very well organized and very clean and welcoming environment. It seems very calm, and even though it's busy, has a good vibe.
Yeah, that's good.
So-
Yeah, definitely it's important. Well, this is Dr. Nicolas, and he's the head of the nutrition here. So
Well, I think that the question that our audience really likes to tune into is, you know, in your opinion or in your approach, what part of the healing process, or how important is nutrition in the healing process, and what is, do you have an underlying philosophy, and where does it look like?
Okay, well, first of all, in here where we are doing our own type of diet, our protocol that we think is the best options to offer to the patients. And saying that, it's a really big part of that, because doing the treatments is going to put your metabolism to work harder, trying to fix, trying to heal. So if you are not having enough calories, the calories that you're supposed to have daily, and also adding these calories that you can burn upstairs, you are going to feel tired. And we need to give the body every little pulse of the big puzzle to try to heal, so that micronutrients, macronutrients, vitamins, minerals is going to be a really important part of the recovery process.
And you do nutritional analysis in-house, blood analysis of...
We, the way that I work, the nutritional aspect, the appointments, at least, I always say the patient is at least is once a week. For example, if I see a patient today, but tomorrow emerges something different, another symptom, it's important to let us know, so that way we can adjust the diet. And yeah, we work with the weight, the symptoms also for sure, and also the blood report. Because the blood report is an awesome tool that they can tell us what is happening inside of it.
So you're sitting in the meetings every day with Dr. Bautista and giving him a report on the nutritional status for each patient every day, or?
No, sometimes we do that, but
Okay.
we are communicating each other. Actually, I was calling another doctor, because every doctor has different patients, different rooms. So I talk with them. If we need to adjust something, is something more important, we discuss that with Dr. Bautista. But if not, we can try to solve that.
Okay, I understand. All right, thank you very much for taking the time to speak with us. We appreciate it.
this is the conference hall. You see, patients are coming in because we have daily orientations. I mean, we want all the patients to know, I mean, the different protocols that or do they have questions about their program. Here the doctor is to answer any questions. So it's very important for us.
In a forum with other patients, so everybody's learning from other experiences.
That is correct.
Interesting.
Yes. So
I like that.
and also for nutrition. You know, when the patient sometimes asks me, I say, this is like a boot camp. You're going to come and you're going to learn a lot.
Yeah.
so you can continue with your, I mean, journey
Yeah.
after you finish your program, because this is a journey, you
Yeah.
know, and we have to set the correct expectations with all the patients.
I think it's very important. I think there are some practices where people go and they just want to be treated. They don't want to know, they don't want to learn, they don't want to do. But our audience, for the most part, they're people who are already in the process of trying to learn as much as they can about how to help themselves heal. And so for us, when we see education taking place like what you're describing, it's we feel it's a very important aspect, especially around nutrition, metabolic therapy, and the kinds of things that people can do for themselves with lifestyles and so forth to help heal. So
Yes.
it's education is
Is key.
a key factor for continued success outside of treatment.
Yes, yeah. Change your lifestyle is very important. Okay, and also, well, this is where many patients love to be. We're going to our restaurant. We have our internal pharmacy for all the medications that we need to be ready for our patients. So everything is here. We have our lab, okay, where we work with all the, that's our lab person, and he's here, and we do weekly evaluations. So we need blood, we need all the things that doctors need to give an update to the patient, you know?
Biological dentistry, I see.
We offer a free consultation with our biological, yes.
see.
So, you know, a lot of patients
Sure.
that have that concern about
Amalgam.
the mouth, and
Yeah.
so we offer a free evaluation, and if they decide to do something, the doctor is here
I see.
by appointment.
That's a third party. They come in
Yes,
and
that's
they
a
work
third
with
party.
you.
Yes.
Okay, very good.
Yes.
And if they want to learn more about that doctor and that the process, they can just go on the site, and
Yes.
I'm sure there's more information about it there too.
Yes, you can go to the site or call us, and we can give you more information.
Okay.
Okay, this is where all the computers are controlled for the building. So,
The IT.
and this is the ITC restaurant.
Nice.
Hello. Hi, Mario. So here's where the patients and their families, I mean, spend time together. We have also we offer meal packages for the companions, so they can enjoy their meals together. This is very important, and we prepare everything here from scratch. So we have our chef and our kitchen crew. That's Aaron, our chef, and
Hello.
so the kitchen crew prepare the meals here.
Very nice.
Hola, hola. Hola. Smile.
Always smile.
We have a nice terrace here as well. So when there's a good weather, you can go outside and enjoy your meals outside. You know, we try to have a peaceful ambience so you can enjoy. And we have this section, so if you wanted to do some work or be with your family, you can be there as well.
The following segment is an edited version of the full clinic conversation available at themossreport.com.
It's nice to make your acquaintance. And I guess the first question I would have is just to hear from you a little bit about yourself, about your background, where you went to college, where you went to medical school, what hospitals or clinics you worked at.
I graduated for UABC, which is Baja California State University. I graduated back in 92, 92, yeah, 93. And I did my internship and my social service year here in in Baja California. At the time, Dr. Moss, my dad was diagnosed with lung cancer.
Mm.
In that period, right when I was graduating, and it was a small cell. So he went through chemo, he went through the radiation. I consulted with my teachers, but he did really bad. He went down quickly, from in like 3 months.
Mm.
He and that's when I started thinking about what other treatments or what other therapies were out there to be able to help my dad. And that's when I started, researching. And back in 2005, 2006, that's when I decided to start my own practice, my own clinic. I started very small back then, and because of good results and hard work and everything, we were able to grow. And now, well, we have Immunity Therapy Center, which I consider is one of the most important clinics in the field here in Tijuana.
So the name of your clinic is has the word immunity in it. I guess when I'm looking at your website, there's a there's a huge array of treatments that you offer. And I'm just wondering, are they all related to the immune system, or do you have other focuses that you also deal with? In other words, I'm trying to get at, I understand the immunity part, but I'm trying to get you at your under the overall philosophy
Yeah.
uh, of cancer, how you're approaching it.
As you know, I was trained in many different alternative treatments, right? And during this process, well, it was really clear that the main part that we need to stimulate specifically against cancer is immune system. But along the way, you want to destroy cancer tissue as well, as quick as possible. Sometimes the immune system takes a little longer, to start doing that. So that's why we do the immunotherapy with all these procedures, the specific killer cell vaccine, the mononuclear cell activation, the specific transfer factors, the dendritic cell vaccines, the macrophage activating factors. But at the same time, we do other treatments as well, like you're reading, like the whole body hyperthermia, local hyperthermia, all these other therapies that are going to destroy cancer tissue a little bit more quickly. So that's the reason why we have all these different treatments. The oxygen therapies and detoxification is really important. So we do treatments for that as well, like the UVBI, the ultraviolet blood irradiation. So I think it's a very complete program where we combine and we complement, Dr. Moss. That's what we are trying to do here, and that's the reason behind it. Well, it's an honor, Dr. Moss, to be with you here.
Thank you.
I heard, I read your report before many years ago. I never thought that I will have the chance to talk with you in person. I thank you, and thank you for all you did, because you were one of the firsts, and that's one of the reasons why we're doing what we're doing. And thank you for all your work.
Thank you.
Thank you very much. We appreciate the tour.
Thank you,
A
Ben.
pleasure to meet you.
Thank you for coming.
For the Moss Report, I'm Ben Moss. How are you healing today?